Welcome to your next module, Clinical Reasoning. Yes, it's me again. So this one is a 13-week module. The final session is a revision session though. The sessions are generally going to alternate between clinical reasoning and pathophysiology. Kerry Bean delivers the clinical reasoning, I deliver the pathophysiology. But we do work very closely together, and you'll see the topics do reflect each other. So it's very well integrated because Kerry and I have worked to try and link it all in together to try and give you both aspects really of the diagnostic process. So Kerry will talk to you about that clinical reasoning process, whereas what I'm hoping is that by giving you the basic principles, I can get you to look at that patient sat in front of you in terms of what is happening to them pathophysiologically, what systems are being affected and how that is then presenting in their signs and symptoms. So it's sort of coming at clinical reasoning from two directions really. In terms of the pathophysiology though, you do need a really good recall of your physiology. So if you've been off doing NMP, you need to do some revision, or if you can't remember it over the summer, then you need to revise your physiology. A good recall of physiology is really going to be key to your success in grasping the concepts in the pathophysiology, because we're going to build on what you did in physiology. Physiology, most of it, or a lot of it, was all about building up, giving you that level of knowledge to then take it forward into the abnormal rather than the normal. The other thing that you need to remember is to use the study techniques that you used in physiology. So the same thing applies. You need to do a multiple selection of techniques to enable you to recall the information. So it's recommended that you continue on a weekly basis, certainly in terms of the pathophysiology weeks, learning the topic material. So this is going to involve making your own notes, your own diagrams, maybe even a glossary again, creating diagrams that you can then explain to someone, repeating it over and over. So speaking and teaching others, all those techniques you did in physiology will stand you in good stead in terms of the pathophysiology. So over this module, there are 200 hours. If you work it out on 13 weeks, that's around 15.5 hours a week, depending on the topic for that week. Due, of course, to dear old SARS-CoV-2, this is going to be a mainly online module, so most of your time is going to be spent, most of those 15.5 hours a week are going to be mainly spent engaging with recorded video lectures, self-directed study, but also attending some live interactive sessions with either Kerry or myself. Your engagement with the module will be monitored via Moodle and also, of course, via your attendance at the live sessions. And please note that the expected attendance of 80% continues. So normally that would equate to you can miss 2 sessions. Not recommended, but you could. So we will translate that in terms of your engagement with the online material as well. So the timetable is available on Moodle, and this is really going to be your guide as to what you should be doing when. So you're going to have to be quite proactive about using that timetable to make sure that you have completed all the various learning activities in a timely manner, or that you join the live interactive sessions as and when you should. Apart from the timetable, the other thing you need to closely monitor is going to be your email, Moodle, and any news forum emails that come out, because any links to live sessions we will probably be sending out to you in that way. So it will keep you updated as to what you should be doing when. But ultimately the responsibility lies with you to engage with the timetable and with the sequenced activities. Pathophysiology has some preparation again. So that is now on Moodle. So you need to engage with that. There are videos there that extend your neurophysiology and your pain pathway knowledge that we did start to look at in physiology a little bit further in terms of pain, because of course pain is a very, very common symptom. So it's a key symptom to get under your belt. There is also some revision there for you and also some quizzes. There are quite a few quizzes for the pathophysiology throughout this module. And again, your engagement with those is monitored. So please make sure that you have done all of the preparation, including the quizzes, before we get to your first pathophysiology session in week 2. Generally, the patho sessions will involve video lectures. There will be a handout that reflects the video lectures, possibly some additional handouts or articles, quizzes, as we said, and also the live sessions, the links, and hopefully the recordings of the live sessions. And as I said before, you ultimately are going to be responsible for making sure that you do those activities in a timely manner, because they have been carefully sequenced to enable you to achieve the learning objectives. Which brings us on to assessment, your favourite subject. So, okay, we've got another exam. The exam constitutes 100% of the module marks, but Kerry will talk to you about the practice-based learning handbook as well, but that is a pass-fail. Yes, you have to pass it, but you still have to pass the exam as well. The exam pass mark is 50%, but all half marks are always rounded up. So if you get 49.5, that will constitute a pass. The exam is divided into 2 sections, both worth 50% each. So you have clinical reasoning as section 1, you have pathophysiology as section 2. There are some example papers on Moodle. To pass, you need to achieve 50% over those 2 sections. So basically, Kerry marks clinical reasoning, I mark pathophysiology, we get together, we add the marks up. If it comes to 50 or 49.5, you've passed. So the overall mark is the combined marks for each section. You don't need to get 50% in each section. However, please do not rely on knowing one section really, really well and hoping to grab a few marks on the other section to get you through. Students generally who have tried that have not been successful. You need to have a reasonable grasp of both sections to pass. If you are unsuccessful, you will need to retake both sections. You can't just take one section, for example. Generally, the exam when we were on campus was a 2.5-hour exam. Because it's now online, it has been extended to 3 hours in recognition of the difficulties with completing an exam online. In addition, of course, you will have your extra time if you've been awarded it. So the exam online is 3 hours. so that you can prepare for the final exam. Unlike physiology where you had lots of little mocks, here we have one full mock. So around about mid-module you'll have a full mock of both sections based on what you've learnt so far. You will get detailed feedback on that, and also the opportunity to have a tutorial if you want to discuss that feedback or discuss any particular issues you have with the topic material. Hopefully I've covered everything. We will have live sessions, so if there's any other questions you can always ask me then. And I look forward to seeing you in week 2.